First thing is we got the result of my antibody test. It did come out positive as expected. So,
Right.
As the doctor who saw me the first time around was there for my test, what does that say to you when you see the results of that antibody test?
So it tells me that you were exposed to the virus got inside your body responded to that by ultimately producing antibodies to help fight off that virus. So that's great news. That means you have a functioning immune system. Obviously, we know from a clinical standpoint, you did quite well with the infection because you didn't end up hospitalized or in an ICU or on a ventilator. So that's all fantastic news. The things that we don't know are how long your antibody response lasts. It is different for every virus, let alone other types of infections. For instance, you can get lifelong immunity with the chickenpox virus. Once you get it, you never get it again, right? Of course, now we have a vaccine for that. And on the flip side, think about the tetanus vaccine. We don't really develop any immunity to that, which is why we have to redo that vaccine and re-inject it every so often. And then there are other viruses like HIV, where we never develop immunity to it in the vast majority of the population. So it's different for every virus. We don't yet know how long the antibody response for the virus that causes COVID-19 will last. We don't know exactly how long the immunity, if that's what it gives us, will last. So these are all questions that we're going to have to find the answers to over the next several months or several years. We do have some past experiences to guide us. We know in general what the length of immunity is for other types of coronaviruses. We know that the coronaviruses that cause the common cold, there's a very short immunity for those viruses. So that doesn't imply a very long immunity for the virus that causes COVID-19. On the other hand, the severe coronaviruses, like the first SARS outbreak in 2003, and the MERS outbreak, which was the Middle East respiratory syndrome a few years later, those viruses, it appeared that immunity lasted for several years, on the order of 2 to 3 years. In this pandemic, I would take that. That would be fantastic. We expect, although we don't know, we expect that we're going to have a vaccine within that time period. So if we could get 2 to 3 years immunity out of this and then get a vaccine available to the general population before the end of that 2 to 3 year period, that would be a win for us. But again, it's going to take time to get the answers to those questions.
Okay. So in the meantime then, while we don't know exactly what it means, what do you recommend for people who know that they have antibodies in terms of their behavior, what they do on a day-to-day basis, social distancing, wearing masks, following the protocols? What would you say to someone who tested positive for antibodies about how they should behave going forward?
For now, until we know what's going on with immunity and how long it lasts, those folks who are antibody positive should behave no differently than if they were not. They should still wear a mask outside. They should still abide by social distancing practices, not gather in large groups without masks. For instance, even if you are immune, does that necessarily mean you can't be a carrier and pass it on to other people? If you come in contact with somebody who's positive a few hours earlier, we don't know the answers to those questions. So it would be quite a risk to simply assume both immunity and that you can't transmit it to anyone else. It's not a risk that I personally would take. So I still do wear a mask and abide by social distancing when I go outside. And that's what I would recommend for other folks until we learn more. And we will learn more. There's no question that we're going to figure out the answers to these questions. We just need a little bit of time to do so.
So, and then you explained this last time, but if you could, again, the two types of antibodies, I know I had one of the two tests. If you could just explain the difference between the two and I guess like the value in each test.
Sure. In general, the test that we're referring to when people ask about antibody testing is what's called the IgG test. The IgG antibody is the longer term antibody. That's the one that in general tells us whether or not we have been exposed to a virus or in the past, or whether or not we have immunity in certain types of infections. There's a second type of antibody called IgM. IgM is actually the first antibody that your body would produce, and that's the antibody used to try to fight off the acute infection. That's not an antibody that sticks around very long. So once it disappears, we can't really use that as a marker for whether or not you were exposed to the virus. It's also important to note that you can't use levels of IgM antibody to figure out if you had if you have an ongoing infection, because it actually takes about a week to develop those antibodies to a detectable level. So if you get the virus on day 1, you become symptomatic on day 3. In a worst case scenario, some patients are in hospitals by day 5. You may not even have detectable IgM levels. So we don't really use that for clinical purposes. But IgG, we know, sticks around. And so we can use that to tell us whether or not there was past exposure to this particular virus.
Okay, and then I know you wanted to do sort of just like a follow-up examination just via Zoom. If you want to go ahead and do that, you can go ahead and do that.
Well, in your case, I can actually gather quite a bit of good information just from looking at you and speaking to you. And that type of information includes the fact that you look well, you're mentating well, you're speaking well, you're moving well. And so that tells me you have a good level of energy. It tells me you are likely not hypotensive. It tells me you are likely not hypoxic. It tells me you're having no respiratory distress whatsoever. So from a clinical standpoint, I'm not worried about you being affected by the virus at this point.
Okay, and then we also know that you retested me for COVID. You did the standard test, the
Right.
diagnostic test, and that came up negative. So
Right. So we call that the PCR test, and the PCR test for you was negative. So there was no evidence of viral material in the nasal tract. So that's fantastic. That's very good to know as well.
So basically, I mean, that is for those of us who recover from COVID, that's sort of the cycle. You have it in your body, and then we're able to fight it off, and eventually we get rid of it completely. Is that sort of the way it works?
That's the goal, and that is what we see in most patients, but not everybody falls into that category. I've had, frankly, countless patients who still remain with positive PCR tests anywhere from 4 to 6 weeks after their first symptoms. So even though most people aren't falling into that category, there definitely are a number of patients who do. And the more I talk to patients, the more I find folks here and there who have symptoms that will last a long time as well. So for instance, the loss of taste. A number of patients are reporting improvement in loss of taste, but not complete resolution of that symptom even a month after they have gotten the virus. So that's quite interesting. I'm sure we're going to see a number of research reports over the next few months that lay out in larger populations how long some of the symptoms will last. That would be certainly an interesting follow-up a few months from now. But in your case, all the symptoms are gone. So that's fantastic.
What does that say that in some cases, you know, for up to 6 weeks, you're still seeing virus in these people? What does that say about this virus in particular?
It tells us that it may not be unlike many other viruses that we in the medical community know. Certain viruses, for instance, the one that causes dengue fever, that could go on for months and months. You can have symptoms from that. In this particular virus, it means that it's certainly still having a clinical effect on patients. It means they shouldn't dismiss those symptoms. Some folks are reporting intermittent achiness even a month out from when their infection originally took place. So they may need to take some medicines to help them with that particular symptom. It means that some people are not going to be back to baseline as quickly as they would like. And so that's important for patients to know. It's good for them to have a set of expectations about what's going to happen with their body and their symptoms. And it's good for people to know that there's nothing unusual about having symptoms that last quite a long time. We've seen it in other viruses. We're definitely seeing it with this virus as well. And so it's just something that they need to monitor.
And then just one more question, as far as you guys over at AFC, how have things been going in terms of the level of people coming in to get tested and to get the antibody test? Are you guys still as busy as you have been?
We're not quite as busy as the absolute peak of the pandemic. We have plenty of people coming in for antibody testing and exams. We have definitely seen some decrease in the number of people looking for initial testing, and that would make sense given where we are on the pandemic curve on Long Island. We're down to, as of yesterday, less than 200 new cases a day on Long Island. At the peak, we were well over 1,000 a day just on Long Island. So that's a very nice improvement over the last 2 to 3 weeks. We're hoping that that continues and that we can all get back to our normal lives very soon.